find the agenda and put that in, paste that in the chat.
Excellent. Thank you, Mark. All right, so welcome everybody to our Consortium of Cities August 3rd, 2022 meeting. And again, I'm Martha Loachman, Boulder County Commissioner. Appreciate you all being here. And as we always do, want to really give a shout out to anybody on this evening who's staff, because this meeting is elected officials around the region, and we know we're on call all the time, but staff is not and should not, but we appreciate you being here and participating in the different ways that you are this evening. So with that, we'll get the agenda put in the chat, but we'll start with, of course, call to order and then introductions, and we'll give an opportunity as we go through the evening. If folks join us, we'll give them an opportunity to say hello and introduce themselves as well. Our meeting topic this evening for Consortium of Cities is behavioral and mental health. And for those of you who haven't participated with us in the past, or maybe not for a little while, I began leading this group last year in 2021 and really was trying to figure out how we could do working groups, collective. We do so much collaborative work around the county, but how can we use the work that we're all doing, conversations that we're having, community issues, constituent concerns, et cetera, and really come together and provide some working group to mentor each other, to provide resources for each other, and certainly for those of us who are in larger municipalities, towns, or counties that have more resources, how can we be neighbors to other boards and councils, et cetera, who may not have the same type of staff, attorney teams, et cetera. So that's what the Consortium of Cities is about. Historically, has done a lot of great work. And this group together chose the topics for our every other month meeting. And so that is the topic that is for this evening, and want to appreciate everybody who's here to do some presentations as well. So then we'll go into our old and new business. We've got a couple different pieces that we're going to really try and keep on our time frame. The presenters, we'll start with them. Your presentation, we would love to hear from you for about 5 to 7 minutes, and then open it up for questions so that folks really can do some lessons learned. This group is about networking, so don't be shy, use the chat. Make sure your contact information is in there, because somebody inevitably will have a question and they'll want to get back together with you later if they don't get a chance to ask their question, or get something going in their mind for later. And then we have our representative, Judy Amavali, who's with us, and we are so thankful this evening. And so thank you, Rep. Amavali, who's going to listen to the presentations first, and then give us some feedback, response, and also talk to us about what's available at the state level for us after this session. So we really appreciate your engagement and the input and feedback that you can provide for all of us. And then we'll hear an update from our regional local wage and that study group. And then we have, as always, your opportunity to share what's happening in your community, give us links, any events, et cetera, so that we can make sure that there's any information that we all need to be aware of. And it might include ARPA, it might include a beer festival, it might include an invitation to Boulder County Parade, or who knows, we'll hear about all of this evening. So again, thank you everybody. We do in this group, we are friendly, we are graceful in regards to technology, and we also do take a break. So welcome to a meeting of Consortium of Cities. So thanks again. I am going to call on folks to do their introductions. And again, if you want to use the chat to put your contact information, please feel free. I will go according to, of course, my screen. So thank you. And I would ask for Mark, if you wouldn't do an introduction, and then Trustee Harrison, and then Councilmember Folkerts.
Good evening, everyone. Mark Rosen, Boulder County Commissioner's Office staff, and it's my pleasure and honor to serve the consortium and serve the commissioners and help this group do its great work. Thank you.
Thanks, Mark.
Good evening. I'm Ari Harrison. I'm a trustee here in Erie. I was elected in 2020, so I'm starting to become a veteran, just starting to learn everything that we need to do. But I'm grateful to have Melissa Richardson here for us to talk about mental health and what we're doing in Erie. So hello, everybody.
Thank you for joining us.
I'm Lauren Folkerts. I'm a city council member for the city of Boulder, about a year in, and yeah, I appreciate having staff here for our presentation as well. Thank you.
Great, thank you. Representative Amabile, you'll have a chance to talk a little bit more, but I do want to just give you a chance to introduce yourself, and then we'll hear from Mayor Rogan, and then trustee Lish.
Yeah, thanks.
Keep going and it may go away.
Hi, I'm sorry, I'm here with my aide, Robin, and so we're trying to figure out how we can both be on the Zoom without doing exactly what we just did. I'm the state representative for what is currently House District 13, and I am running for House District 49 because of redistricting, and I'm really delighted to be here, and I'm glad you all are talking about behavioral health.
Thank you for joining us.
Thank you. Good evening. That sounded a little bit like a dance party, Representative Mobley. I'm Holly Grogan. I am the mayor of the town of Lyons, and previous to being seated as mayor in April, I served on the board of trustees for 2 years, and I just love this group. I'm happy to be here tonight.
Thank you.
Good evening, all. My name is Ken Lish. I am one of the members of the Superior Board of Trustees. I apologize for not being able to make the last few meetings, but prior to that, I've been sitting as Superior representative on this group for about 3 years. I'm glad to be here tonight. Nice to see you all.
Thank you. And then I've got, and I apologize because I'm gonna mess something up here, I'm sure, but and I can't remember if it's Mayor Lenark or if it's trustee, and then Marcy Campbell, and then Councilmember Martin.
Well, it's former Mayor Lenarsic, and I'm representing the town of Jamestown.
Thanks for joining us.
Good evening, everyone. I'm Marcy Campbell. I work for Boulder County Community Services and serve as the Behavioral Health System Project Manager. Nice to see everyone.
Great to see you.
Everyone, I'm Marcia Martin, Longmont City Council since 2017, on this consortium for the last 6 months or so.
Great to see you. And then we've got maybe Dan Casey. I don't know that we've met. I apologize if there's a title I missed. Robin Bohannon, Lisa Moreno, and then Jim Adamsberger.
Yeah, good evening. I'm Dan Casey. I'm the Director of Human Services for the City and County of Broomfield.
Thanks for being here.
Hi, everybody. I'm Robin Bohannon. I'm the Director of Boulder County Community Services.
Thank you for joining us.
Good evening, everyone. Lisa Moreno. I am the Behavioral Health Strategic Planner and Community Services in Boulder County.
Thank you.
Good evening, everybody. I'm Jim Adamsberger, staff with the Community Services Department, and I'm supporting some of the behavioral health planning work.
Thanks for joining us. We've got Elizabeth Crow, Jason Balling, Tucker Ehrman, Councilmember Schaaf.
Hi, everybody. Good evening. I'm Elizabeth Crow, and I'm City Boulder Housing Human Services Deputy Director. My first consortium meeting, so I'm looking forward to it.
Thank you.
Hi, everybody. I'm Jason Balling, Director of Public Health in Broomfield, and joined this group years ago with Jeff Zayak, I think to discuss opioids. And so it's timely that I'm back and presenting on our behavioral health improvement plan.
Thanks for coming back to the consortium.
Good evening, everybody. My name's Tucker Ehrman. I use he, his pronouns. I'm a member of the Boulder County Behavioral Health Planning Team under Jim Adamsberger and Robin Bohannon.
Great, nice to meet you.
Nice to meet you as well. Thank you.
Councilmember Devin Schaaf with City and County of Broomfield. It's good to see you all tonight. Happy to be here.
Thank you. And then we've got Jacqueline Terry, Melissa Richardson, and Robin Noble.
Hi, good evening. My name is Jacqueline Turway. I'm here on behalf of the Colorado Municipal League. Behavioral health is one of the issue areas that I cover for them. And just so you know, I'm probably going to turn my video off because we're just putting my toddler down. So in case he runs in the room, I don't want him to come and interrupt everyone, but I am here. So thank you guys.
The toddler's welcome, but absolutely we understand.
And multiple of us might have that problem, so you're not alone.
Melissa.
Hi, I'm Melissa Richardson, and I am the co-responder in Erie, and I also work for Boulder County. And I'm just here to help Trustee Harrison with presenting about Erie.
Great, thank you.
Hi, folks. I'm Robin. I'm Rep. Amabile's aide. I'm sorry my camera's not working on this other computer. All kinds of technical difficulties. Nice to be here.
I feel like you could just shift over to the other side of the table with Judy. Yeah.
Hi.
Thanks, everybody. Really appreciate you joining in and participating with us this evening. We'll jump into our community presentations. Mark, I think you probably have the order for us, so feel free to jump in and we'll get going. Again, if you try and keep around 5 to 7 minutes for your presentation so that we can ask some questions and have some dialogue about how we can work and help you.
We do know that Boulder County will go last, so why don't we just start with Boulder, City of Boulder, City and County of Broomfield, and then Erie, and then move to Boulder County.
Great, thank you.
Okay, that means I'm first to test the screen share. And Mark, I'll look to you for this if I need to stop or wave or make big noise. So again, I'm Elizabeth Crow, Deputy Director of City Boulder Housing and Human Services, and I'll try to be brief. I'm going to guess that a lot of us are going to be raising the same or very similar themes and issues this evening. So our mission is to strive for all people to thrive in City of Boulder HHS. We primarily do that through affordability, inclusivity, and of course, mental behavioral health is a thread that ties so many of our community needs together. What we know is from what we hear from our community members directly, from our staff members who are very community facing, talking with individuals in need and in crisis every day, and also from our nonprofit partners who we really rely upon as partners to help us address the many needs in this area and others in our community. And this is really the bullet list, right, of what we hear and what we see. The kind of root causes or some of those intermediate social determinants that involve everything from economic challenges, which can then include a whole range of different employment, housing challenges, the overwhelming impacts of people experiencing racism, sexism, heterosexism, other forms of discrimination, all the way through immigration status, violence, lack of safety, social isolation, all kinds of forms of trauma. And one of the questions posed to us all tonight is what impact COVID has had. And I think we all know it has just absolutely exacerbated all of the problems that existed well before COVID. And, I think one of the things I'm looking forward to hearing and talking about this evening is what changes we have seen that have taken place because of the focus we have put on this issue, and obviously what remains to be done in terms of direct services, investments, and partnerships. In terms of the needs, then, if those are some of the experiences, these are, again, some of what we hear are most necessary. Certainly the crisis intervention, what we hear pretty consistently and frequently from our nonprofit partners and service providers is that the level of mental health needs it's all increasing, and the severity is also increasing. And so the number of people who need crisis intervention, who maybe years ago might have benefited just fine from a more mild form of intervention or service, is something that we're really paying attention to. And then all of these other things from, again, like the crisis intervention to the preventative measures, including pro-social activities. And that's for people of all ages, whether it is our young people who need to engage in healthy activities, or our older adults who are experiencing extreme social isolation and loneliness and are also at risk. And another kind of need that we hear about, of course, is at the systems level within our organizations and within our city infrastructure, is a great need for workforce capacity. We're aware that this is a national problem. It's not only City Boulder, it's certainly not only Boulder County or our region. What we know from our community members and nonprofit partners as well is that it's really important to have centralized access to care from our larger health provider agencies like mental health partners, like Clinica, like Boulder County Boulder Community Health, sorry, but also kind of the decentralized access. So the number of organizations that are academic support groups for low-income youth who have integrated mental health into what they provide, or other types of organizations that are not kind of primary mental behavioral health organizations who are doing that integration. We're seeing and hearing every day the need for more mental health professionals of color, LGBTQ professionals, examples of what's been wrong, with systems and kind of the discrimination compounded by many decades that has exacerbated that problem now under COVID as well. And then, of course, a multi-generational approach so that people of all ages and backgrounds can get what they need. This is just, I kind of am repurposing this slide from a recent presentation to our Boulder City Council members about some of the services that we provide in HHS directly, and just want to highlight a few of them that really do incorporate very directly mental services. CERT, or the Crisis Intervention Response Team, is our co-responder program, which we actually house the staff in Housing Human Services that work side by side with police department, police officers to respond to people in crisis. Our family resource schools and our older adult service programs also provide direct funding to individuals if they need, low-income individuals, Latino families, if they need to get help affording therapy and mental health services. And they also actually, we have for years actually had a contract with mental health partners to be able to have therapists so that we can make those direct referrals and references. So that's some of what we provide directly through our department. But for the most part, we really utilize the resources that we have, the investments that we can make in our nonprofit partners. And listed here are 3 primary ways that we do that: through our Health Equity Fund, our Human Services Fund, and our Substance Education and Awareness Fund. And I know Robin is familiar with the last of those 3, certainly, because the Substance Education Awareness Fund is sourced by our recreational marijuana tax, as well as our electronic smoking device tax. But through all of these, those 3 local funding sources that we manage in HHS, we have many hundreds of thousands of dollars going out to a variety of nonprofit agencies for that centralized and decentralized care and programming for mental behavioral health. And then lastly, we do intend to make ARPA investments in this area. We had originally said for our tranche 3 ARPA investments, we wanted to spend about 2.5 million. That may be changing just based on some other demands that have come up more recently for those funds. And so, to be honest, we're still working on exactly what that's going to look like, and want to have that informed by many of our partners, aware that the county has its path forward for mental behavioral health. We do really want to focus on workforce capacity because we see that as something that, again, is a clear need and can really complement the kind of annual investments that we're making. And so just to say, these are some of the organizations that we have been funding for a number of years, and which we have strong partnerships, and we appreciate every day the work that they do to try to make our community more whole in this area. And then lastly, and I'll end here if I haven't already gone over the 5 minutes, that we have really appreciated and look forward to continuing relationships with our partners at Boulder County and other municipalities in several different ways, including working very closely with county staff on the roadmap. We're participants, as you all are, in the Regional Opioid Council and have HHS staff member as our representative on the operations board. We talk about this issue a lot in terms of how we're all allocating our local resources and some federal resources through the Funders Collaborative. And I skipped over that top one, which is that we really work hard in our department to just stay in constant contact with our nonprofit partners so that we're not waiting until a funding report or waiting until there's a new crisis for them to reach out to us or for us to check in with them. So in the whole, I'm really trying to make sure that we do behave as a good partner and hope that other people will see us as a partner and look forward to more collaboration in the future. That's all I have. I've got contact information here and I can put it in the chat as well. I'm happy to take any questions or just, I'm not sure what you want to do, Marta, now or kind of hold them till the end.
No, this is great. Thanks, Elizabeth. Okay. Appreciate that. And absolutely put your contact information in the chat for folks who are participating. So let's take a few minutes and reactions, questions, thoughts from folks.
Judy.
Rep. Amable.
Yeah, so thank you so much for that. And I appreciate it. I'm just wondering, I didn't see much about the people who have more serious illness, like people who had schizophrenia, bipolar with psychotic episodes, schizoaffective disorder. And also I didn't see much about what's happening at the jail. Now that is the Boulder County Jail, and maybe that's why that's not part of your presentation, but I'm wondering about the people with more serious disease. And I'm going to talk about that a little bit in my presentation, but just wondering if Boulder had a plan for that.
Yeah, it's a good question. I mean, I think the jail, the point about the jail is we'll hope that our colleagues at the county will be addressing that. It's certainly something that we're concerned about with everyone, and some of the nonprofit partners to whom we provide funding are also working in that space with people in the jail system. And as they are exiting that system and re-entering the community. For example, we do provide funding to groups like Focus Reentry to make sure that people who are exiting that system are able to get the medications that they need and help making appointments and follow up. We do know, that it's certainly not exclusively the kinds of very kind of extreme mental health disorders and diseases you mentioned are not exclusively experienced by people experiencing homelessness, but for our community as a whole, that's what a lot of people see. And so our co-responder programs, and again, working with other municipalities on what we see there, certainly the connection between people experiencing substance use disorder and other, kind of high acuity needs, people who are very high utilizers of the emergency room for services. Those are all kind of what we're trying to address through the services that we have directly, like co-responder, but primarily, since we're not kind of a public health department and don't have professionals embedded other than our CERT team, we really rely on our nonprofit partners and municipal and county collaborators to help with that. I hope that's helpful.
Great, thank you. Councilmember Schaaf.
Thank you. I'm glad that we're talking about mental health. It seems like that this is a conversation that is happening, almost at a national level right now. Just the other day on what is it? Last week tonight with John Oliver on HBO, he talks about mental health. And you had mentioned the workforce shortage, which is also something that he talks about as well. I'm curious if you have an idea of what what percentage under you are in Boulder in terms of the workforce for mental health. Do you have an idea of kind of how many more spots you would need, or just kind of what is the dynamic in terms of what does that shortage look like in Boulder?
Yeah, I actually can't. I'm going to do a little bit of digging when I'm not on camera and see what some of our latest, kind of information is from mental health partners. And I'm guessing that some of our county folks will have some of this information a little bit more handy. But, organizations like mental health partners have had tens and dozens of vacancies. And that's been the case for some time. I think folks are familiar with the situation recently where they had to reduce the crisis center over the weekend because they couldn't staff it, and that some of the fixes have been to kind of rearrange, right? It's not as though they had a massive influx of new staff members, but we're trying to rearrange staffing so they could reopen that center more fully. So those are the kinds of things that we see. There are some individual therapists that we're hearing from our nonprofit partners still have the capacity to take more people on, but they don't all take Medicaid. They're not always accessible to people at lower incomes, and voucher programs go a long way. But if you kind of exceed the number of visits that are paid for, you might end up in crisis. So I'm kind of being glass half empty here. I think that the folks who we have in these roles are working incredibly hard under very challenging circumstances. And the more that we can do to try to look up the pipeline is going to help in the long run. But my sense, and again, I'll look to others to chime in here too, is that it's not going to be a quick fix.
Great. Thank you, Elizabeth. Thank you, Boulder folks, for being here. Who's up next, Mark?
Broomfield.
All right. Take it away, Broomfield.
Sounds good. And I'm in a similar approach. Now I get to see if my screen sharing works. So here we go. You all see my presentation. Wonderful.
All good, Jason. Yep.
Great. And I'm going to have to shift now because it's on another screen, but I'll be pointing this way, but realize I'm presenting to all of you. Yeah, it's a great opportunity to be in front of this group, and Elizabeth did a great job. I could almost say ditto on most of the points in our presentation, because that's exactly what we're facing in Broomfield. But I did want to share a little bit about what we face in Broomfield. We're unique. We're a small county, 33 square miles. We cross multiple regions when it comes to service delivery from the state, and we're defined in many different regions. And we have different community needs. And so my presentation, and I'm lucky to have Dan Casey, who's our Director of Human Services, joining me. We've been co-partners on addressing behavioral health since 2017. And Dan and I have many late night conversations on what are we doing well and what could we do better. So it's great to have his partnership, and I expect him to interject as we go along. So when you talk about some of our Broomfield challenges when it comes to behavioral health, and some of these have been touched on already by Elizabeth, but I attended a presentation from the Trust in America's Health, and it's a public health organization that looked at how do we address behavioral health in the United States? And we're looking at some of this in Colorado with behavioral health transformation. And when you look at it, our current treatment approach is we have 5% that we're talking about the severe mental illness, 20% with a diagnosable disorder, and then 75% of our population. And people fluctuate, again, based on diagnosis and situations and social determinants of health, where they fit within that spectrum. But when you think about how that applies to Broomfield and some of the challenges we have is one, provider capacity, that was already brought up. We've heard both from mental health partners and community reach that they don't have enough providers, and there's not enough providers in the pipeline to be able to fulfill that need. And that's looking just at basic crisis services. And then you have outpatient services and other services going on in the community. So it is something that definitely needs to be addressed, but it's going to be a long-term solution. I don't think it's anything we're going to do overnight, especially in Broomfield. We don't even have intensive treatment locations in the city. So we're reaching out often or referring people to other cities in the region when it comes to intensive treatments. And so when those locations are already full, or like we said, some of them have to reduce hours, it impacts the ability of residents to get services needed at that point in time. Obviously, we know it's a very fragmented system. When you're looking at how the Behavioral Health Administration is addressing it moving forward and trying to coordinate, there's so many different agencies that touch this, so many different programs. And the idea is, how can we come together locally to have a coordinated approach? We've heard a lot from our residents when we went through our community health needs assessment that the system is just so hard to navigate. And we hear that often from people on Medicaid, and obviously those that don't have insurance, but also from those that are insured, navigating the system and being able to get in somewhere. As I mentioned before, we cross multiple regions. And then lastly, just that we're going to be facing a challenge that is going to be with us over a period of time, because the behavioral health transformation is going to take time for them to work on some of these long-term solutions. So it's good to see they have some things in the work, but we have to expect that a lot of that's going to be built as we're doing the work we're doing right now. Our approach in Broomfield is in 3 pillars. One is to change the narrative, so really addressing the stigma around mental health and behavioral health, reducing barriers to services. And lastly, what our community really wanted to focus on is what's the positive aspects of overall health and well-being, and how do we make that a culture? And so we're really focusing on community connectedness. How do we decrease social isolation and exclusion? And some of the things that we've done is we're with partners in actually the region, running media campaigns to reduce stigma. So we've done the Let's Talk About It campaigns. We brought in multiple people to share their stories. These are recorded stories. This is something now that Santura and other health system partners are looking to expand across the entire state. We are also building a community partner capacity to help promote those messages in hard to reach or underserved communities. So community ambassadors carrying the message that are those trusted individuals in community instead of us as the government entity coming in. As far as access to care, there's so much that we have to wait to be built out, but we've really tried to promote what's available out there. We do have a co-responder program. We could obviously do a lot more in that area. We spent a ton of time of expanding from one community mental health center. We used to just have mental health partners to bringing in community reach, because half of our residents are closer to the Adams County side than the Boulder County side of receiving services. And that's helped at least expand access to care. We have a very engaged regional council, and we've really focused on bringing those in with lived experiences. And then we did receive a grant from the Department of Human Services to help mental health partners retain existing staff. And so that's one like small stopgap measure we could take as far as addressing that workforce capacity. And then we also have a monthly community connections court that as people are going through a community court, what we know is often they're there, but there's a need of not just sending them out the door. How do we connect them up to services? So our human services agency works very closely with our court on that. And then for community connectedness, we've done some really innovative programming through our Communities That Care Coalition, such as we've partnered with school districts to really promote and incorporate social and emotional learning. We're seeing a lot of that expanding. We've looked, how do we reduce isolation for some of our senior population through a pen pal program by bringing some of our Adams 12 students in to connect. Diversity, equity, and inclusion, we've made the forefront of all of this work and all of our connectedness work. How do we approach that from that lens? We did offer free passes to our rec center, especially for those youth that would not be able to traditionally get it. And then we have a very active youth coalition, and they did a photo voice project that really identified some of the strengths and barriers that we see as far as youth connectivity and stress and anxiety in youth and how we can improve that. I won't go a lot into this because Elizabeth already touched on it. I would just say as we look at this population health approach and where do we ultimately want to go? Sort of this resonated with me of how do we, for those that have been diagnosed, make sure they're getting effective and efficient clinical care. For those that are at risk, how do we mitigate risk and provide that early intervention? And then for those that are in that sort of healthy phase, we all have good days, we all have bad days. How do we build up those resiliency skills and allow people to continue to thrive? And so some of the things we've identified are more funding, obviously, continued use of telehealth, enhancing the workforce. This was brought up with our BIPOC ambassadors, LGBTQ plus populations and community health workers, funding high qualified mental health professionals in schools. We've heard a lot of that from our community, and then continuing to integrate primary care and behavioral health. And so I know I went through that pretty quickly and I probably went over my time, but I hope that was helpful, and I'll stop sharing my screen if I can.
Jason, thank you. Thanks for the presentation, for being here. It looks like Trustee Harrison.
Yeah, thank you very much for the presentation for both that have gone before. I guess the question I would have with all the great activities and the solutions that are out there, how are you able to measure it in a way that not only is on the smart stuff with percentage, et cetera, decrease, whatever, how do you measure that in terms of and other data that's out there to say, okay, we are making headway, or we need to focus on this area more than this area? Is there any way that you have a mechanism for that helps?
Yeah, obviously, I'll just speak from Broomfield's perspective. We get all the quantitative data we can look at to show whether or not we're improving or doing worse, both from our providers, our community, and also from our surveillance systems. But the other thing we're looking at are more what are those qualitative data sources and non-traditional data collection methods. And so when you think about community connectedness, we're really talking about belonging. Do we all feel like we're included? Do we feel like we belong in our community? And so going out and having more dialogue and discussions to measure success versus trying to track that through like a more traditional data collection measure. And that's just one example from Broomfield.
Thank you.
Thank you. Other reactions or questions from folks?
Oh, there's one other one I would also suggest is, we have the Colorado Health Access Survey that's available from the Colorado Health Institute. We have the surveys from the State Health Department. The one that I have found probably the most insightful is the Colorado Pulse survey by the Colorado Health Foundation. And they even break it down by subpopulations. And it's more around attitudes and beliefs of Colorado residents versus specific behaviors. And you can dive in. I'll make sure I follow up and send the presentation. There's a whole section on mental health. And to me, that really spoke to, here's what Coloradoans are saying they need. How do we begin to adjust to solve some of these issues?
Thanks for that. And feel free to send that everybody, feel free to send presentations or any follow-up documents to Mark. And he's nodding, so that's why I'm volunteering him to send out to everybody together. Councilmember Chef.
Thank you. So, Mr. Valling, you had mentioned a phrase that's been in the media quite a bit lately, actually for a while now, social emotional learning within schools. And it's gotten a bad rap in the political sphere, but could you explain that and kind of talk about why that is so important for learning within our schools, especially as we continue to go through kind of the waning pandemic?
Yeah, just at the very high level, there's a lot of programs tied to it, but it's how do we interact and deal with each other, right? From that social, emotional perspective. And it's really giving the students those tools and resources to be able to address and handle that. So we have programs like Sources of Strength. Actually, I'm not going to list them all because there's a lot that I could go through. But from my belief, in order to be able to thrive and to learn well, you also have to be able to feel safe, feel like you belong, and feel like you have some of those resiliency tools to be able to be present and really engaged in school. So I know it does, I've heard some of those comments around social emotional learning, but to me, it's one of the key investments that we can make to begin to address some of our mental health issues across the country.
All right, great. We've had a couple other folks asked to present this evening too. So just from a time perspective, I'm gonna try and keep you. You're not there for me to do an elbow, so just maybe try and keep an eye on clocks. I believe we're to Erie. Is that correct, Mark? Okay.
We'll have Erie, Superior, Lyons, and then Boulder County.
Great, thank you.
So I'll start and be very quick. So real quickly, when the new board was elected in 2020, which of three of us came on, one of the things in the heat of the pandemic that we all felt as a board, that when we eventually through it, we were going ongoing and then going through it and afterwards, was what are we going to do about the mental health quotient for our town? We felt that was very important to be taken a look at and try to figure out a vehicle to do that. And so what came back to us was the co-responder program. And so we had a study session about it, I believe, and we got briefed on it. We did some due diligence in regard to that and felt that it was something that we in the town of Erie that's growing as quickly as we are could take on in the funding side of that, and felt that was one of our priorities. So we had those conversations, and then on the 27th of May of last year, we brought Melissa Richardson on in that role. And so it's been about a little over a year that she's been involved, and she's done a very good job in terms of trying to really deal with the things on a tangible level, and then coordinate activities and et cetera. I'll let her talk more about it. But in Erie, I think the big thing that we had a concern with when I talked to the chief in just an offside conversation, at the beginning of the pandemic, we trustees were getting emails from residents just complaining about basic things. And we're using F-bombs and dropping this and dropping that. And I took a step back and said, is there more to it than just normal complaints? And that anecdotal evidence of what they've seen from a police department perspective was something that was real. And so I think to that point, that was something that was important to discuss. And so I'll leave it to Melissa to talk more about it.
Yeah, I'll share.
We can see it. Thank you.
Okay, perfect. And it's short and sweet. I just did a brief overview, and I can really speak to a lot of the co-response in the police department. So some challenges in Erie. This is our co-response data from January of this year to May. And so that chart shows of the 96 active co-response calls and case management referrals that we dealt with here in Erie. The majority have been mental health related. And then you'll see followed by parenting and then older adult and geriatric calls. So that's the summary of our data here. So big issues we've ran into are the limited availability for mental health professionals and especially psychiatric care as well, which I know other people have touched on as well. A lot of people have left the field with COVID. Technically, I also left the field because I'm not doing individual therapy anymore. So I understand like there is that huge need for that therapy piece and long wait lists, things like that. And yes, COVID has definitely increased the mental illness and substance use that we've seen, and it's just dealing with that since that's been a lot of people's coping skills. And then our efforts here in Erie, we've really tried to be informative with the 988 crisis line. So getting that out onto social media, telling people about it, however we can, word of mouth, just to spread that around as a resource to people. So hopefully they'll know they can utilize it. And a lot of people don't even know that co-response exists either. So utilizing that as well. We did National Night Out last night here in Erie, and that happened all over Boulder County. It was fun. Corresponders were everywhere too, just sharing about who we are and the resource we have and how we are here to help the community. So that was really fun. And Trustee Harrison mentioned where, he advocated along with other trustees to bring me on, and then we proposed for another corresponder to come on. So that's going to start in January. We're bringing on a second corresponder. So that will be really exciting just to have another person here and just more hands to help all the need in Erie. And that will expand our coverage time too. So we're hoping to go from 10 a.m. to 10 p.m. versus the 12 p.m. to 8 p.m. So that will give us some more time that we're on and able to help. Another thing at the police department, they're hiring a victim services and restorative justice manager, and she starts the 22nd of this month. So that'll be someone housed here in Erie, more accessible and also easier to collaborate with on my end. So we can tag team with different needs in the community and help assist however we can. So I'm very excited about that. And support needed, low-income housing, it's not very accessible. And I know that's a need all over Boulder County. Just really seeing that, and that's the same case in Erie. We have people who, whether they're in a hard situation or whatever it is, they need those housing resources. I mentioned the psychiatric care, especially for community members with Medicaid and children, has been really, really challenging. Seeing the wait list for child psychiatrists and things like that has been really hard, even to children's, like getting people referred there. It takes some time. Easier access and availability for geriatric mental health. That's a lot of our calls too, but what are the things that they need? For example, individuals that are aging in place and suffer from dementia. I've seen, especially with families who have private insurance, they can't afford to put their loved one into a long-term care facility. So then they're trying to figure out other ways to manage them, and they're not really living. So just that is a huge need. And then care for this is currently very expensive. So that's the barrier there. And then the inpatient substance abuse services for adolescents. A lot of our teams are struggling with substance use. They're trying to cope with the isolation and everything they experienced through COVID, and then maybe getting behind with school and everything. And yeah, there's a lot of need. We deal with a lot of stuff with the school resource officers. I've partnered a lot with them to help just support all those students in schools. And that's all I have.
Great. Thank you both. Appreciate the presentation from Erie. Questions, reactions? it'd be helpful just to put your contact information in the chat as well, both of you, in case folks do have some other questions. Going once, going twice. Okay. Let's see here. Sorry, Mark, I should have written that down and I didn't.
Trustee Lish, and then Mayor Rogan, and then Boulder County.
Thank you.
Good evening, everyone. I will be brief. So here in the town of Superior, we are obviously a small town. We're only 4 square miles. So I figured I would kind of give the perspective of a smaller municipality. I know there's a few others on here who are smaller than us, but we're also very different than Boulder and Broomfield and the county. So we do not have the resources to directly dedicate specific staff to this issue. However, it is an issue that we have prioritized and are integrating into other parts of our town services. So I was going to spend a little bit of time discussing the co-responder program, but thanks to that fantastic presentation just now, I don't have to do that. All I'll do is just give it a plug and say it's been great for us, and I would recommend it for those of you who have not yet implemented it with your municipalities. We've had it for about a year, and it's received very good reviews from our residents, and we've also seen just from the reports how beneficial it is from a quantitative perspective. The second area that is kind of the elephant in the room for us is the Marshall Fire. Staff made connections very early on with mental health service providers and took on the role of facilitating connections for our residents shortly after the fire. So staff was stepping into kind of new roles and doing what they could on an ad hoc basis. And then we also then facilitated and hosted group sessions at our community center, both for discussion purposes, as well as connecting folks to professionals for later sessions. But we also tried to communicate this as much as we could through our social media, through our e-blasts, and through all of our other various channels. One of the things that I am proud of is we have one of our advisory committees is our Cultural Arts and Public Spaces Committee, our CAPS committee, and they partnered with our Superior Chamber of Commerce to develop an art therapy program that just received rave reviews. We ran out of spots, had to put more sessions together. We thought it might be a short-term thing. It is continuing on to today and beyond. It's just been a incredible resource for those who are continuing to struggle with the mental effects of the Marshall Fire. And then also one of the things that we did early on was work with the Colorado Department of Public Health and Environment in utilizing their crisis counseling program for others that were impacted by the Marshall Fire. So it was trying to find an all hands on deck approach to provide the resources our community needed at that time. And then the only final thing I'd like to highlight is another advisory group we have within the town is our Superior Youth Leadership Committee, SILC. They are our high schoolers. I think we might have one middle school on there, middle schooler on there. But this is something that they took on and really took leadership and ownership of last year. And they put together a mental health campaign in which they presented and brought forth ideas, not just throughout the community and our community channels, but also to the local high schools. And their campaign really stressed 3 topics. One was school stress and available counseling. One was depression and anxiety. And the third was suicide prevention. And they took this on because this is what they heard from their classmates was needed and necessary. And I'm really proud that it was something that they were able to do. So if anybody's interested, I can certainly share other resources from them, but that's the approach that we've tried to take, not directly because we don't have the resources to directly address this, but kind of integrate it throughout everything we do in the town. So thank you very much.
Thank you so much for that presentation. Any reactions or questions? All right. Thank you. Who's up next?
I believe that's me.
Yep.
Yeah. And we have Superior Beat as we're 1.2 square miles and 2,000 people. So I wanted to give a little additional context about what it's like to be in a very small town and try to provide mental health services. And for us, it's our Lions Emergency Assistance Fund who provides mental health services. And just a couple of data points. According to them, 57% of folks getting services are extremely low income, 26% are very low income, 12% are low income. So that leaves 5% of people accessing services are not considered low income. There's a huge need. Leaf expressed to me that they are looking for partnership of all kinds. They're very resource constrained. And it's a wonderful organization. I'll give them another plug later when I talk about their fundraiser. And then the other thing I wanted to discuss was the co-responder program. So Lions has a full-time co-responder now. She started in May. She's based in Lions. She has an office in the Sheriff's Department. And just to give you some context about the need that we have here, in 2021, in the entire year of 2021, there were 13 co-responder contacts. And that was a co-responder who's working for Boulder County, not located right here. But the entire year, there were 13. In the month of July this year, our co-responder had 13 contacts. So the program is so necessary. One thing that our co-responder shared with me is that when she goes on a call with a sheriff's deputy, the deputy winds up learning so much about how to interact with people who are having mental health challenges or any sort of challenge that doesn't really require policing. So it's a huge benefit. I completely agree that if you don't have co-responders and you can get them, do that. So thank you very, very much.
Thank you. Any reactions or questions? Okay. Great, thank you. Who was next? Was it Boulder County? Okay.
Yeah.
We're a grace-filled group, so don't worry. Rep Mobley.
I appreciate that. Keep talking. I'm going to find this.
Okay, I just had a quick question for you, Mayor Rogan. What is that person who's the co-responder if they're responding to 13 calls a month? Is that your full-time person or that was, so what are they doing the rest of the time? Are they working with those people who they co-responded to and trying to connect them with services, following up with them, or what is it that they do?
That's my understanding. They work with whatever county resources are appropriate, and with LEAF, who is a social services net, to get them the help they need. Other than that, that's a really good question, and I will ask, and I'll get back to you.
Great, thank you.
Nope, that's not it.
Oh,
sorry.
It says BH planning.
Yes. So you do see the slide. You do see the, okay, great. Awesome. That's great. Is it the right size?
Yes.
Great. Okay. Good evening, everybody. So I'm the behavioral health. My name is Lisa Moreno. I'm behavioral health strategic planner at Boulder County Community Services. And I'm a part of a very small team that was created at the beginning of the year to focus exclusively on behavioral health in Boulder County at the macro level. We're a part of Community Services Strategic Initiative Division, and our work is spearheaded by Robin Bohannon and Jim Adamsberger. Our team has been tasked with, we're given the responsibility for 4 main bodies of work. The first is to create a strategic plan for behavioral health in Boulder County that looks out 5 to 10 years. We're calling this a behavioral health roadmap. Second, we're tasked with supporting ARPA for the projects in the area of mental wellness and social resilience. Third, we're supporting Boulder County's opioid settlement planning. And finally, when the time comes, if the time comes, we will be tasked with exploring the readiness and need for behavioral health tax in the county. To develop a comprehensive roadmap for the county, we're centering our planning on the goals of improving equity for priority populations, access, especially for the right services at the right time, improving system capacity, and overall management evaluation. As we go through all of this, we intend to make sure that we're leveraging existing knowledge and past planning efforts and assessments and aligning our efforts, our plan with state efforts and new funding opportunities. We are starting this process by identifying key focus areas in the system of behavioral health, and actually saying system of behavioral health always makes me a little bit uncomfortable, because the reality is that there isn't a system of behavioral health. It is not a system. It's a hodgepodge of programs and funding streams that doesn't necessarily go together, but there's no other way to talk about it except to say system. So where we've decided to begin our exploration into behavioral health for the county and create this plan are looking at structures and governance that other communities have used as they've created their own strategic plans. Also key infrastructure for us as such as navigation, referral platforms, and integrating 988. Improving community crisis response, such as more mobile response and co-responders, and looking at strengths and gaps in this current continuum of care across the continuum of care. We're also going to be consistently looking for opportunities for system integration and alignment, and ways to actually deal with the question that came up earlier of how do you actually know if you're making headway? So coming up with plans for evaluation and performance management. To support ARPA, as most of you probably know, the county ARPA process resulted in impressive community engagement and the investment of $11 million in projects, specifically in the category of mental wellness and social resilience. Our team helped fine-tune the plans and develop budgets for the community members' proposals. And in the end, the projects that were approved by the BOCC, included mobile response, crisis response teams that were delinked from law enforcement, community-facing a navigation hub, and 4 projects to improve equitable access, including grants to community-based organizations to expand services they're already providing, mental health vouchers, school-based services, and community trainings. We intend to incorporate all of these new projects also in the behavioral health plan. Soon, the Boulder County Regional Opioid Council will be seated, and their job is to finalize and submit a plan to the Attorney General for the use of settlement funds in our region. Our team will be the staff for the council, and we have already convened and started facilitating an operations group to advise the council. To date, we've, with the ops group, have organized key data indicators to tell the story of opioid use and impacts in the county. We've put together a detailed list of shovel-ready opioid programs and projects gathered from county, city, town, and nonprofit partners, and this list will be prioritized and will form the basis of recommendations for the council. In addition, after the first 2-year plan is filed, our team will get to work with the operations group to provide recommendations for a longer-term opioid response strategy. And then lastly, as I mentioned before, when the time comes, we, as directed, we will work with stakeholders and constituents groups to assess the opportunity on readiness for behavioral health tax in the county. And I have contact info should anyone want to follow up.
Great, thank you. Reactions and or questions with Trustee Harrison?
Thank you. First off, for everybody who did presentations and the staff that did a lot of the work, kudos to all the work that you do. I know it's challenging. I know it's under-resourced. We would all like it to be more. And I think I'm putting on my project manager hat because that's what I do for a living in the tech world. And that is, from a threat perspective, obviously funding is a big key concern, I would imagine, long term. How do you sustain it? Because I see ARPA funding is important and it's a shot in the arm, but this has been something that's been ongoing for not just the last 2-3 years, but 50 years, 60 years, and et cetera. How do we kind of sustain that out and long term and keep it in the people's consciousness that this is just as important as it is to making sure that people are wearing seatbelts so we can reduce people dying in our cars back in the 70s and 80s? How do we keep that going with those challenges that are there?
I believe that question's to Boulder County.
That's for everybody. Anybody can interject because you all have different perspectives, different things that you see and that's unique to your community.
I'm happy to start that conversation. I think it's a really important question. And I know that we'll hear from Representative Amabile around opportunities given the state legislation that she's pioneered and additional funding sources. I think we're sort of at a tipping point. Today, our department received a long list of federal grant opportunities addressing these behavioral health issues. We really see the ARPA funding as sort of bridge funding to make sure that we have proven programs that can actually be then ready, shovel ready for the new federal dollars, as well as the state dollars that are coming because of the behavioral health transformation at the state that we've never seen before. So I think it's a cautionary tale, and I'm glad you're bringing it up. But personally, I see the opportunity that we've never seen before.
And I would just add to that it's hard to sustain something if you don't know what it is that you're trying to sustain. And it's hard to set priorities for things over the longer term or know when to take advantage of opportunities as they drop if you don't have some sense of a system that you're trying to support and objectives you're trying to reach. And so I think the hope is that by having a little bit more of a rational, organized system with priorities, we know where we want to invest, and also having metrics that help us reflect back on what we're learning, what we're accomplishing, where we still have work to do. We have a better idea of how to continue to invest in the system in ways that move us in a direction where we're in a process of improvement and also achieving greater and greater outcomes over time.
Yeah, from my perspective, there's never going to be enough funding to do what is needed. And so we're really talking about culture change and community change in Broomfield. So for example, lack of providers, we're saying, how do we create more touch points in the community, those that could be trained in behavioral health, but not necessarily have to be a practitioner that's licensed to do this work. And so a lot of that we're trying to build in through existing community coalitions, efforts, et cetera. And, you know, we have our nonprofit grants that Human Services distributes. And that's the other part of this is we really need to begin to address those social determinants of health to begin to make inroads into this issue. So I think as much as we can not only talk about funding, but how do we start to break down some of those policies and systems that create these barriers and begin to make it easier for people to get what they need.
I was going to just chime in quickly. I think the analogy you used was very poignant, the seat belts, right? That becomes habituated behavior over time. People didn't used to wear their seat belts and now they do. The same thing with mental health. If we take that population approach, more of a preventative approach, mental health doesn't have the stigma that it had before, right? We start to break that barrier down, and now it becomes that kind of habituated, unconscious competence behavior that you're saying, I broke my ankle, I need to go to the doctor, or I'm not feeling well, I need to go see my clinician. And that stigma piece is really, I think, where we can target. It doesn't take a lot of funding. It doesn't take ongoing dollars in perpetuity. I do get worried also from our perspective about ARPA funding, and it is bridge funding because it's not there forever. So what if we stand up these amazing programs and in 2024, the money runs out, where do we go next? So we've got to think of that, that ounce of prevention is worth a pound of cure approach, and really start establishing in our presentation. I can share this quickly again. I don't know if it's worth the time, but our population health approach that Jason talked about during the presentation, and really keeping healthy people healthy. Again, another correlation, you could say homelessness, right? Let's try to keep folks in their homes as opposed to getting more inflow into our system. With behavioral health, let's try to get people healthy and keep them in that healthy space so that we're still, again, preventing long-term or greater problems downstream. So that's probably an impossible question to answer, but I think there's some good approaches we could take.
So I'd love to jump in if that's appropriate.
Rep. Amabile, if you don't mind, we're at a time crunch at this point, and so I would love to just turn it over to you for your presentation, because we have a few other pieces of the agenda. So if that's okay,
Sure.
And then you can incorporate your responses as well.
Sure, yeah. So how much time do we have? Because we prepared a presentation that's a little bit, it's probably more like, well, when I say we, I mean Robin. And so it's a little bit longer. We'll just start, and Marta, you tell me to stop. Give me the cane if we go on too long.
Okay, we have, and this is going to be, it might end up being a group decision here. I think we were anticipating 10 to 15 minutes, and we had 4 folks sign up to present this evening, and we've had some great dialogue, and we've had some additional presenters. We still need to hear from our local wage study group team. We still need to hear from the community input process on open space, that presentation. So just to give folks an idea, and we can always forfeit our 5-minute break as well, which is an option. So let's start there. Let's start with your presentation, and I'll try and gauge that. Does that work for everybody? Okay. Hearing no major objections, let's go forward.
Okay, I'm a pretty fast talker. So I do want to start by addressing, I'm really glad to hear you're talking about this tax. I think it's no secret to anybody on the call that I've been very much advocating for their countywide mental health tax. I hope that when you start to work on that, if you decide to, and I hope you do decide to, that the cities will all be involved, so that all the great programs that are being developed in all the cities, including Lyons and Lafayette and Louisville and everywhere, will be included in this conversation, and that the work they've done will be part of what you end up with. And this tax, or some tax, if you decide to do it, is what will help you with the ongoing funding. And then the other thing I would say about, well, how do we get the funding? We're already spending the money, and we're spending the money in jails. We're spending the money on homeless services. We're spending the money on these crazy short mental health stays. We're spending the money. So I would love for us to agree to spend the money differently than how we're spending the money right now. But anyway, so let me just start. We have problems to solve. I'd love to talk to you about what happened in 2022, and then we can talk a little bit about what we have in mind for 2023. Mental Health America last year rated Colorado dead last in the nation for access to care for adults with mental health needs. And just to put a point on that, 51 out of 51. So we came in behind Alabama, Missouri, Mississippi, Puerto Rico, you name it, we were last. We do not have the inpatient residential capacity that we need. For people with serious, severe, and persistent behavioral health diseases like schizophrenia, schizoaffective disorder, bipolar with psychotic episodes. The recommendation is that we have 50 beds per 100,000 people. In Colorado, we have about 10 beds per 100,000 people. People with high acuity conditions can and do recover, but they need a different kind of care. And the people who have these high acuity conditions are the people that are living on our streets, that are in our jails. And that somebody pointed out that's only 5% of the population, but it is costing us a large percent of the money that we spend, because short-term hospital stays, jails, street shelters, and the morgues, this is all very costly for our community. And all the criminal justice involvement and cost of lawyers and public defenders, and not to mention that these are human beings who lives are being devastated by the lack of care. And so I just want to touch on some of these human beings. This is Sarah. Her son, who's an adult, has been hospitalized more than 30 times. He's not a criminal. He's very ill. He's currently in jail.
Play the video.
And if you don't mind, we're just going to play this really quick video.
Today, my son pled guilty to a felony after spending 14 months in jail and in the state mental hospital here in Colorado. His crime is severe mental illness. His actual charge was trespassing. And this happened because after trying unsuccessfully to get him into long-term treatment and inpatient hospitalization, after having 8 hospitalizations that were short-term within a 6-month period, his father pressed charges for trespassing against his son so that he could get into the criminal justice system, so that he could then get into the state hospital. The way this works in Colorado, we do have a civil hospital, a civil route, but we only have about 600 beds at this point in the state of Colorado. 600 beds for the whole state. We are at the bottom of the barrel. Can you imagine if you had stage 4 cancer and you had to wait 9 months for treatment, and then once you got treatment on top of that, you had to get a felony for having cancer? It's insane. We have to change the way that we think about mental illness. We have to change the way that we fund it, the way that we talk about it, especially in the state of Colorado.
Patrice, her son spent 4 months in solitary confinement in the Larimer County Jail, waiting for a competency bed. Then all of a sudden they decided, okay, he can get outpatient. He was still actively psychotic. So they sent him off to live in the street because she couldn't have him in her home. He did come to her home, he beat her, and then he went back to jail with felony charges for assaulting his mother. Patty, her son was caged in a rural jail, and I've been to these jails and they literally do have cages, with treatment for 55 days awaiting, without treatment, 55 days awaiting a bed at the state hospital. He'd gotten in a fight over a hamburger and French fries, which resulted in him being thrown in jail and then spending 25 months in this system. Sylvia, she lives here in Boulder. Her husband, her kids, their son is in jail now. He's been there for over a year. He has two felony counts, 5 misdemeanors. And his crime was that he also was discharged from a short-term hospital stay before he was ready. He went back to his mother's house. He beat her to the point where she was hospitalized and had to have multiple surgeries. And now he has felony charges and has spent 17 months in the Boulder County Jail waiting for a bed at the state hospital. We'll skip this next one. But I just wanted to put a little bit of a human face on what's happening here, because I think those of us in these jobs where we're policymakers, sometimes we lose sight of who it is we're doing this work for and why we're doing it. In 2022, we took $450 million of ARPA funds and allocated it for behavioral health. What should be of interest to you is that 90 million of that went for community gap grants. That means that the county, the cities, the judicial districts can all apply for money from these community grants. And these are one-time funds. So the money can be used to stand up a group home or stand up a inpatient residential treatment program. Whatever it is you feel like you would like to spend this money on. There's also $62 million for the intersection of criminal justice and mental health. So pretrial diversion, co-responder programs, MAT treatment for opioid use disorders. And the idea here is that you will leverage your opioid funds with the money you can get from these grant funds to make that opioid settlement money go further. And that if you, like with the opioid settlement funds where you created regions, you could also do that with some of these behavioral health funds.
Put the full list in the chat.
We'll put the full list of all the bills in the chat, and it's a PDF that you can access. But I also wanted to mention that we also passed some bills that had to do with some of this entanglement of mental illness in jail. So we have a new policy now around competency restoration that should allow for more people to be out in the community getting competency restoration as an outpatient. But that is going to need places for people who are homeless to live while they're getting this competency restoration. We also put $30 million into competency restoration beds. We added $5 million to the pretrial diversion program. And I think some of you may have heard that the Boulder County DA used that money, just got a grant with this money to expand the pretrial diversion program that they were already running. We ran a bill that says people who have been found not guilty by reason of insanity some of them don't need to be in the state hospital. We have at least 60 patients at the state hospital right now who don't need that level of care. But what they do need is a place to go. And so this bill says, hey, let us at least get them through a process so that if they don't need to be there, they can be released into a lower level of care. And then we also did a complete rewrite of the 2765 statute that governs involuntary commitments. One of the bills, though, I do just want to highlight because it was the one that I carried that I really think will help make a difference, is about creating more beds, because every one of these mothers would like for their person to get a bed. And that is 16 new beds at the state hospital and 125 new residential care beds that are going to be distributed around the state in these 8 to 10 bed facilities. And these beds could be used for people who need competency restoration, but they can also be used as a step down for people coming out of jail, for people who are coming out of the state hospitals. And you all should be lobbying for some of those facilities to wind up in your communities. Or that's what I would be doing if I was you. So how can communities apply for funding? The Behavioral Health Administration is developing an application process now. If you keep your eye on these websites, they will be making an announcement. They will be pushing this information out to you all. But right now is when you should be preparing for applying for these grants. And again, there's no community too small and no community too big to apply for these grants. And in the meantime, if you want to talk to somebody about what should you do to prepare, Emily Hansen from the Behavioral Health Administration would love to help you.
Put all this.
And we can put all of this in the chat too.
Thank you. Just a point of clarification, Robin, while you're putting that in the chat, it looked like Emily Hansen's last name is spelled 2 different ways in that slide. So just to make sure that we've got the right contact.
Oh, thank you. Sorry about that. You got it.
No apologies. Just want to make sure we've got the right info. Thanks.
Thank you.
So this last one is about this tax. And so I recently wrote an op-ed with Sheriff Pelly and with Michael Doherty, our Boulder County DA, because like I said, we've been visiting with this idea for the last 3 years. Right now we have a tax that is funding the alternative sentencing and modernization of the Boulder County Jail. And that tax is set to expire in 2023. And our hope is that the county commissioners will see it as in our community's best interest to ask the citizens to roll that tax over and use that money to pay for ongoing costs so that we can leverage all of the federal dollars that are currently available, use that money for capital infrastructure, and then use the tax money for the ongoing costs. And you could say that I'm a dreamer, but I'm not the only one. And I hope you all are going to join me in this dream, because I do think we could make a huge difference for the people in Boulder County and Broomfield County if we work together to figure out what is the best solution out there and how much does that cost? And then how can we leverage the ARPA dollars and then use this ongoing funding? Other counties have done it. Summit County has done it. Larimer County has done it. They've done an amazing job. They're building a beautiful new facility with beds and with treatment and can be used with their jail programs. They have it all coordinated. And what they're doing is really forward thinking. And they would love to come and help us here in Boulder County do something similar that, you know, is tailored to our needs here. And then just briefly in 2023, I mean, we're going to continue to work on this competency problem where we have people stacked up in jail. We're looking at ways to improve medication-assisted treatment for people who have substance misuse disorder. We're talking about expanding the workforce by expanding the types of professionals who can prescribe psychiatric medications. And then we have stood up a commission to look at our jails throughout the state of Colorado, and they're going to promulgate standards for all the county jails so that we don't have places that are really, medieval in their physical attributes and also in the way that they are treating people who are in those jails. And I'm open to any suggestions you all might have in terms of legislative solutions to help you all do the best job you can do for this population of our fellow humans.
Thank you, Rep. Amabile. Appreciate that. Oh, go ahead.
Working on getting some information out of our all payer claims database so that we can understand how much money we're spending on short-term hospital stays, whether somebody on Medicaid gets to stay longer or shorter than somebody on private insurance, what's the readmission rate across this system, and get the information that we need so that we can make these hospital stays more helpful and more, and that's it. If you all have questions, thank you for indulging me.
Thank you. Appreciate you being here and presenting and listening to the previous presentations by everybody. Thanks to all the staff that's here supporting this work. And so I want to make sure that we are keeping our time, and I do want to acknowledge that Jeff Moline from Boulder County has joined us to talk about that next item. And I also don't want to rush through this conversation and the dialogue. So what questions do we have? Ideas? We've got a representative of Mobley here, and I know some folks had reached out just asking about funding and what are those opportunities and processes. So I just want to make sure we have time for that.
I think the only suggestion I would bring is if we're 51st in the country, let's look at what the top 5 or 6 are and what the distinctions are between them and us, or even middle ground, and say, what is that distinction, and have conversations with those legislative members from those states to say, what did you do different?
Yeah, I totally agree with you. And, you know, we did also, it's not in this presentation, probably it should be, we stood up this behavioral health administration, and that came out of the work of the previous task force. And that's part of what they're doing, is looking at what are the best models around the country and how can we adjust the way that we're structured, because there are some really big structural problems that lead to all these gaps in our system. We have this healthcare policy and financing, which manages all the Medicaid dollars. We have other funding sources from state funds. We have these regional accountability entities that we have 7 of those across the state. And then we have our 17 community mental health centers. And the interaction and the intersection of all those organizations must not be working as well as it could, because I know you're all hearing the frustrations of people around the state who can't get the care they need from their community mental health center. And part of that is because the community mental health center can't get the reimbursement that they need from the RAY. And part of that is because the RAY isn't getting enough funding from healthcare policy and financing. So, and they are looking at all of that, and they are looking at all the ways that we allocate the Medicaid dollars. So on the behavioral health side, that's a capitated system. On the physical health side, that's a fee-for-service system with Medicaid. And they're looking at that to see, is this the best way to do that, or are there some opportunities to make some changes? But I will just go back to this. I think a lot of local governments, counties, and like Summit County is a great example. They just decided, okay, this community mental health center that we have here this is not working for us. So we're just going to go it alone. We're going to pass this tax, and then we're going to stand up the system that we think works for us. And I visited their jail recently. They have all staff in their jail, all the medical and mental health staff in their jail are hired and employed by their county jail. And they're just doing amazing things with the people that they have, and with getting them into services, and making sure that when they leave jail, they have supports, they have housing, they're back on their Medicaid, all those kinds of things that we could try to mandate at the state level. And believe me, I'd love to try, but they're just doing it because it's the right thing to do, and because they know it will save them money in the long run.
Appreciate it, Representative Neville. I learned a lot from your presentation, and to be clear, when I was talking about the 5%, I truly agree with you. We need to make sure that we're fulfilling the needs of those that need the most intensive care. I think the struggle we're having in Broomfield, just to be completely honest, is how do we locally build something in a system at the same time the system's being built at the state, and making sure they're alignment. And so things I'm hearing from the Behavioral Health Administration is they're going to be going to a BSO model, and we're still not fully sure what that's going to look like. Who's going to be then contracted to do that? Who are they going to be reimbursing? And so the challenge is to start to build something locally, and then you're fragmented with some of the payment systems, if that makes sense, or some of the alignment they're trying to create at the state level.
Yeah, I totally appreciate that. And I do think a lot of things are in flux. But one thing that's happening right now is that this money is available and it's only going to be available one time. And so I think if you could envision what are all the sort of one-time needs, like let's say you wanted to set up a fully non-police response system. So like what they have in Denver, a STAR program as opposed to a co-responder program. What do you need for that? You need some vans, you need training, you need some staff that, you know, you need to set up a system for that. And that's something this money could be used for. And you know you're going to need that upfront money, and then you're going to need to fund the ongoing costs. And I get the difficulty with the co-responder model or with this STAR program model that you don't want people who are not busy doing this work. So you don't want to have too many people, but also you need to have somebody who is there to do these responses all the time in order for that to really be effective. So I know that doesn't address all of your questions, but frankly, I would be surprised if the new system doesn't quite closely resemble the current system. There might be some subtle differences, but it's not going to be some radical change. We are still going to have community mental health centers. They are going to be more than likely the entity that is the safety net provider. And we are still going to have regional accountability entities. And I don't expect that to change, but some of the ways they interact might change.
I want to open up for one more question just because we need to move to our next item here at 8:10.
Okay, well, thank you guys so much. And I really appreciate hearing what all of you are doing. And I hope you'll all reach out, especially if you have legislative priorities. I'd love to hear what they are. I'd love to help you get those things done. And I'm just gonna put in another pitch I was really excited to come here tonight because I want to see all of you work together to come up with what is the gold star solution for Boulder County. We are one of the wealthiest counties in the state. If we can't, and we're progressive, we're forward thinking, we're smart. We have some of the smartest people in the world that live here in Boulder. So let us all work together and bring all this talent that we have together and really design the best system out there. Let's be the best.
Thank you so much for being here, for listening, and for responding to questions and sharing what you're working on and giving us some exciting information. So, and thank you, Robin, as well, for being here.
Thank you, guys.
Thank you so much.
Yeah, we'll log off. So,
okay. And if there's any attachments that you want to be sent out to everybody, send those over to Mark, and we'll make sure that gets
yeah, put some of these links in the chat too.
Great. Thank you so much.
Thank you.
Thanks.
Bye.
All right. And we're going to move to, so Jeff, Moline, if you don't mind just doing a quick introduction, because what you missed at the beginning was everybody gets to introduce themselves. I don't want to be remiss not to give you that opportunity. And meanwhile, in the background, Jeff has graciously offered to come back in October and share the presentation. But go ahead with your introduction.
Hi, everyone. Good evening. Thanks for your service, by the way, from all of the municipalities. So I'm the senior planner with our Parks and Open Space Department, and was going to talk to you this evening about our open space and trail request process that we have with all of the municipalities. But seeing the important work that you guys are discussing today, we're thinking that maybe October would be a better fit for that discussion, since you're running a little short on time. And so anyway, I'm hoping that will work out with you all, and we're in touch with all the open space staffs at all the municipalities, and continue to work with them. So from the staff side, I don't think it's a problem, but just wanted to express appreciation and look forward to seeing you in a couple months.
Thanks, Jeff. And I think that's great for all electeds to hear that that will be on the agenda for October so that you can plan accordingly.
All right.
And be ready
Great.
with questions, et cetera. So great, thank you. All
You
right,
bet.
so we're going to move to our regional local wage update with Councilmember Folkerts. And we've got about 20 minutes. I apologize that we missed our break tonight. What we don't do is go over, so so be prepared, everybody. And then if we have a couple minutes, we'll go around and just share any items of importance for folks and communities. But thank you.
Thank you, Marta. So let's see. We've been working on kind of coming up with an outreach and engagement plan for minimum wage and talking to our communities sort of about what that might mean or what that might look like. One of the things that our last meeting, I think, has made really clear is sort of the importance of having a really robust discussion that is very thoughtful. So one of the things we're looking at is having the minimum wage working group bring forward presentations that then could be, that then the municipalities could opt to have be brought to their communities. So we'd kind of like have an introductory presentation of, you know, looking at, having someone from the Division of Labor Standards and Statistics talk about what this minimum wage ordinance requirements are, you know, what they've found from Denver's implementation, talking about self-sustaining wage findings from the Center on Law and Policy, and also looking at workforce wage and trends. And so the idea was that we would get that group of presenters together to kind of give a presentation that, you know, anyone from the consortium, or I mean, anyone else could join, and then have the ability for municipalities to kind of bring that in the way that makes sense for them to bring that presentation or presenters to their communities. And we would do a couple, right now we're thinking we do a couple of cycles of that. So there would be sort of that introductory section, and then a second set that was around, you know, bringing in county level, you know, probably first we'd look at stakeholders that are regional, like AFL-CIO, Northeast Chamber Alliance, some of these, you know, NAACP, Colorado People's Alliance, bringing a lot of these groups that are interested in this topic together to then sort of have like a next round of, you know, what this might look like. And then similarly kind of doing another version of that in our communities with more local stakeholders. So kind of this cyclical process going is what we're looking at right now. And as we sort of talk through this, I think it made sense that we're not, in order to do a really robust process like that, I don't think we can have implementation at the end of the year. You know, it's going to take us a little bit of time to work through that with all of our communities, especially. And as we talked about it more, it made sense that we really want to do it that way to sort of give the communities time to coalesce around what makes sense collectively and to try and get the biggest buy-in possible. I think that, you know, our business community and as well as, you know, people who will be who are, you know, meeting this minimum wage, who are affected by this wage rate, you know, really trying to make sure that we have the broadest, most equal coverage is really beneficial to everyone. So because of that, we're kind of looking at lengthening the process a little bit. So it would go beyond this year, and doing sort of this multi-staged engagement plan. And so one of the things I just wanted to check in with everyone on is, you know, some of the issues with, like, are we expecting a lot of turnover on the consortium, or are people like staying on for more than 1 year? I'm just kind of trying to get a feeling of continuity, and what concerns people might have about shifting to a later timeline, or if there are any concerns around the consortium or the working group sort of taking the lead and setting up some of these presentations that would then be brought to these communities.
Thank you. So what I'm hearing, it's a couple different questions. Oh, go ahead, Mayor Rogan.
Thank you. Thank you for all your work on this. Really appreciate it. And from my perspective, I think taking longer is a great idea. You know, I brought this to the Board of Trustees and there was zero interest in pursuing it, for reasons that I think I told you, which is, you know, we're small, we're a seasonal town, you know, but I think that the more information people have, the better, and folks might change their minds once they learn more. So I think it's terrific, and I'm so grateful for this working group. So thank you.
Trustee Harrison.
I echo Mayor Rogan in regards to that. I think, Lauren, all the hard work you're doing, might as well take the time to do it, complete and thorough job of it. You know, from a political perspective or anything like that, all I know is for Erie, we have home rule that's on our docket. That's something that's coming up. We know that that's going to be a spend, considerable spend for us, and we had a lengthy discussion about it last week in our meeting, that went longer than we all thought it would. And but that's one of the things, and then some other budget items that are coming up that have priority. So I think something like this is important because it does speak to the housing affordability issue. Is what we're trying to do in Erie. Is we're trying to get that off the ground, because we want to have people who work in Erie live in Erie. And if your average price of a home is $600,000, that's not going to cut it. And so we are intentional with that. So I think something like that, go through it and take your time that you need.
Thank you. Trustee Lish.
I'll just echo some of those comments. I think this is a really good initiative to be working through and coming to solutions on. Again, elephant in the room, Superior, Marshall Fire. What we are hearing from our residents right now is that anything that takes our attention away from our recovery and rebuilding effort is something that we should not be focusing on. So my guess is for the next 1 to 3 years, new initiatives are going to be a hard sell to our residents. So just planting a seed for where our focus will likely be for the next couple of years at least.
Thanks for that. So just to be clear, we talked a little bit about trying to move this because there's a January 1 date that we would be working on. So it's either right now and January of 2023, or give it this year, which I heard Councilmember Folker say, then that, and then that would be January 2024. So that's, we need to get a pulse from this group. Go ahead, Councilmember Martin.
Yeah, I'm sorry to take people off topic. I have been out of state with a family emergency for the last 5 weeks, and Mayor Peck has just left for a family vacation today, so she and I didn't intersect on our way out and in. I had wanted to be involved with this effort, but felt that I didn't have the bandwidth. And she and I talked about her finding someone else to represent Longmont, but I don't know whether she did because we had no intersection. So Lauren, could you fill me in on that real quick?
Yeah, so Susie was able to make the last, the meeting that we had with the working group. And Devin, correct me if I'm wrong, but I kind of felt like, you know, the two of you were actually part of sort of this modification to this proposal. And I think made a really strong argument for how this made sense to move a little more slowly and thoughtfully and intentionally with how we bring this forward.
Thank you. I'll get the rest of my catching up from Susie.
Great. And just by note of, for awareness, Trustee Brown, who's also been part of that working group in and out and expressed some real interest, message and was unable to join us this evening. Didn't give me a vote, yes or no, because we weren't at this point of the meeting, but just so folks know there was involvement, there is still interest, but that's why Louisville's not represented in this conversation tonight. Anybody else want to give a, go ahead, Mark. We're missing you still.
Sorry, I hope you don't mind if I ask a question. So Trustee Lish, just to clarify a little bit, certainly understand the Marshall Fire focus. And Councilmember Fulkert, you can correct me if I'm wrong, but one real value I see of the working group in this process could be that this is a good example of perhaps the more resource communities might be able to support work that could then be taken up by the smaller communities. So I guess what I'm trying to say is if there was the ability for Superior to engage with this work that was more of a lighter lift, then you might typically have to put into an initiative, given the pressures you're facing with Marshall Fire recovery. Do you think the town board might be interested in something like that, where you might be able to, I don't want to say ride the coattails, that seems a little strange, but just be able to collectively work with the other consortium members on this in a way that might not be require so much bandwidth from your board and staff?
Can I jump in with a thought real quick? Which is, you know, especially for like the communities that I think have really, in some ways, obvious partnerships. You know, I'm thinking about like Louisville and Lafayette and Broomfield and Superior. It kind of feels like maybe it's not, you know, Devin, I know you're really actively engaged in this. And so maybe it's something where, you know, Superior and Broomfield are partnered a little more. Might that also, you know, make a little bit of sense? Or do you think it's just untenable?
So I'll preface everything with, it's hard to speak for the board at this moment because we are about to undergo a huge transition. We have a mayor who is rolling off, and we have 4 open trustee spots in November. So we are going to look incredibly different as a board come November. I'm not going to remain on the board, so I'll be gone, and some of my colleagues will as well. So anything can change at that point. What we have going on right now in our community, which has elicited a lot of very, very strong opinions, and what we have heard kind of in aggregate, we've got a huge development coming through in downtown Superior that would actually bring jobs into Superior. We've been a bedroom community, and we actually have an opportunity to do kind of a live and work thing. But that has not been necessarily received with open arms. And then we're also at the very, very early stages of looking at affordable housing in the Superior marketplace. And again, that hasn't necessarily been received with open arms, mostly because of people trying to focus on rebuilding all the homes that were lost, which I understand the irony in in those arguments. But that's where we're feeling the pressure from our residents right now, that broadening conversations, whether we have the bandwidth or not, they see it as a distraction. I honestly think if we talk 6 months or 12 months from now, and we've seen measurable growth and there's a new board in place, then it could be a different conversation. But if I were to go back at my next board meeting and try to pitch anything as a new initiative, no matter what the lift is, it's going to be a hard sell.
Thanks for that. And it's good for our awareness as well as colleagues around the region to hear that update. Trustee. So we're about to be out of time. So I just want to check in with you, Councilmember Folkers, if you've gotten at least some of the initial information that will help you. And I'd love to have you put your contact information in the chat, just in case there's somebody else here that wants to join in on that study group. But I heard a decision just from a number standpoint of this consortium group saying yes on focusing on 2024 versus 2023. So thank you for that. We've just got a couple minutes, so I want to make sure that folks, if there's any announcements, Mayor Rogan, you had already given us an awareness that there was something you wanted to share, so please go ahead.
Yeah, it's a super fun event. It's the Lions Hootenanny. I'll put the link in the chat, although I apologize in advance. It's a Facebook link, but it's a fundraiser for LEAF, and it's down at Riverbend by the river. Commissioner Lochamin came last year and gave it rave reviews. So it's August 28th, I think, from 2 to 6, and I'll just pop that link in the chat. Come see us.
Thank you. Others? Go ahead.
I'll give a quick plug for the Superior Chili and Beer Fest, which is September 17th, and it is just fantastic. It's an afternoon event, and it's definitely our sparkling type event of the year, and I recommend anybody who has the time that day to come and join us, and I'll put the details in the chat.
Sounds great. Go ahead.
Yeah, so this isn't necessarily an event that's coming up. It was a performance that I just saw today by the Butterfly Effect Theater Company, Betsy, who's out of Boulder. And they presented a truck performance of Amelia's Big Idea, which is all about local government and getting big ideas through the red tape, through the process, and what that takes and what that looks like. Phenomenal performance. Somebody that is very much engaged in local theater, but of course local government. Just loved it. It was a great performance. If you get the chance to see that, please do. I think they are going to be wrapping up their truck series, but hopefully this will be a performance that they will revive in the near future. Please do go see it. It's phenomenal.
Great, thank you. Trustee Harrison.
Yeah, so we have a unique event that's coming up on August 13th. It's called Touch a Truck. And so for all those little kiddos and others who want to take a look at different kinds of trucks and get inside them and see them and all that sort of stuff, that's coming up from 9 a.m. to noon. And I'll just put that link in the chat for that upcoming event that we have.
Excellent. Thank you, everybody. The Boulder County Fair is back in action this year for anybody who's interested in the fairgrounds. The parade is this Saturday at 10 a.m. So that's the only item I have to share. So thank you all of you for your collaboration for the long night. Staff, just a reminder, tell all your staff who participated that we really do appreciate them. And of course, Mark, for bringing us together and keeping all the emails and the time and the Zoom together. So thank you all. Have a great night and take care of yourselves.
Thank you.
Thank you.
Good night, everybody.
Take care. Bye-bye.